Hi, everyone. Welcome to today's session. In this video, I am going to walk you through exactly how to use the PHQ-9 questionnaire to help identify signs of depression with clients. The PHQ-9 is one of the most widely used tools for depression screening. And it is something that we have seen most social workers, therapists, counselors, clinicians, as well as other healthcare providers are comfortable using as part of their portfolio of tools. Now, what is the PHQ-9? It really stands for Patient Health Questionnaire 9. It is really a brief, self administered screening form with 9 questions that align with the DSM criteria for depression. And we will discuss a little bit more about the DSM criteria for depression. People refer to the PHQ-9 as the PHQ-9 test, the PHQ-9 screening tool, or simply the PHQ-9. Whether you are assessing a new client, or you are checking in with a patient, or tracking progress over time, this tool is incredibly useful. In this video, I will show you how to administer it, how to score using the PHQ-9 scoring scale, and also how to interpret what the PHQ-9 score actually means. Let's jump right into it. Let me share a quick example of how the PHQ-9 screener can make a real difference. Let us take an individual by the name of Jeff. Jeff is a 24-year-old college student who went into a campus clinic complaining about fatigue and a lack of focus. Nothing serious, right? Or so it seemed. The clinician handed Jeff the PHQ-9 questionnaire. And after a period of time, after completing the questionnaire, Jeff turned it in. His score, 19. That meant moderately severe depression. And once again, we will go over the scores and how they are calculated and what they represent in a few minutes' time. So back to Jeff. He scored a 19 score. Now, the score helped the clinician recognize the seriousness of the situation and referred him for further care immediately. This is just one example of why the PHQ-9 screening is so important. It can flag what might otherwise be missed. In real-world practice, the PHQ-9 is used across hospitals, schools, private practices, and even via telehealth. It is quick, effective, and helps create a shared understanding between your client and you, the provider. Okay. Now, sometimes people often search for things like, what is PHQ-9 score meaning? What does it mean? Or what does the PHQ-9 results really mean? This video will break down all of that for you step by step. Let's go on to the next slide and address the PHQ-9 questions. There are 9 items total, and each one targets a symptom of depression. Like, for example, low interest in activities, feeling hopeless, sleep issues, low energy, changes in appetite, feelings of failure, difficulty concentrating, moving or even speaking slowly, and thoughts of self-harm. Now, these questions make up the core of the PHQ assessments. Clients respond based on how often they've experienced each symptom in the last 2 weeks. They rate each one on a scale from 0 to 3, from not at all to nearly every day. The format makes this a true PHQ-9 rating scale, which helps standardize depression assessments across different providers and settings. You will often hear terms like PHQ-9 scale, PHQ-9 depression scale, or PHQ-9 tool. Don't be confused. They all refer to the same thing. Many professionals also use a printed PHQ-9 form or even a PHQ-9 assessment PDF. You can always find versions online, such as the PHQ-9 test online, which clients sometimes complete before an assessment. We will provide you with free templates, free forms that you can use. In addition, if you take a look at the bottom of this video, we will show you the link that takes you to the full guide. Let me talk about the full guide next. All right, so what we are looking at here on my screen is the page that you will land when you click on the link below this video. It is free, it is public, it is created for you. You can save it as a PDF, you can share this with your colleagues, you can save this and then come back to it again and again. Use it as your guide. When you click on the go to list, it really takes you to the table of content. And here you will see detailed responses to the different topics here. For example, you see where it says PHQ-9 test overview. But when you click on that, it provides you with the detailed section that provides you with a lot of information about that. To go back to the table of content, you just have to click on go to list, and it brings you back here. You will also see detailed information in regards to the questions. So let me click on that, and here are the 9 questions that I referenced when I was going over the previous slide. Let's go back to list. You see here where it says PHQ-9 scoring and PHQ-9 interpretation. When you click on that, it gives you a detailed overview of what the scoring and the scaring really represents. In addition, I mentioned free templates, and we do have free templates included on this guide. So once again, don't hesitate to click on that link to be taken to this free detailed guide. Okay? All right. All right. Next, let us do a quick deep dive and talk about the PHQ-9 scoring, which is really how you interpret what those responses mean. As I said earlier, each of the 9 questions is scored from 0 to 3. So the total PHQ-9 score ranges from 0 to 27. The higher the score, the more severe the symptoms. And here is the PHQ-9 scoring scale broken down on this slide. 0 to 4, minimal or no depression. Keep what I just said in mind though. 0 to 4, minimal or no depression. Because even when you get a low score for a client, there are some things you need to keep in mind. We will discuss those shortly. 5 to 9 signifies mild levels of depression. 10 to 14 signifies moderate levels of depression. 15 to 19 signifies moderately severe levels. 20 to 27 signify severe depression. This breakdown that you are looking at here on this slide is known and is referred to as the PHQ-9 score interpretation. And it is really key for determining the next steps. Please keep that in mind. The score interpretation is really key for determining next steps. For example, a score of 10 or higher usually means that clinical follow-up is needed. Now, we have seen social workers, clinicians, and other healthcare professionals, they sometimes ask questions like, what exactly is this PHQ-9 score? Or what is PHQ-9 score meaning? And that is why we decided to include this slide as part of today's demo. That's where this interpretation comes in. It turns a number into an actionable plan. When we present it like that to professionals, it really rings a bell. The score literally allows you to turn a number, to take a number and translate that into an actionable plan. One thing to note before we go on to the next slide is this. You can also use a PHQ-9 calculator, which you can find online. So if, for example, you just Google PHQ-9 online scoring tool, you can find a lot of templates and a lot of tools that you can use to quickly total the results during your session. But we also provide you with such tools. When you go to the detailed guide, you will find links where you can access such PHQ-9 tools. On that note, let us go on to the next slide. Now, for this next slide, what it really represents is how professionals are using the PHQ-9 every day. It is really important to understand that the PHQ-9 is incredibly flexible. And it's not just for psychologists or psychiatrists, social workers, nurses, clinicians, case managers, and even school counselors. They use it all the time and in all kinds of settings. The PHQ-9 assessment can be used at intake, during ongoing therapy, before discharge, or even during remote care sessions. Some providers now, they choose to use the PHQ-9 scoring method weekly to track client progress over time. Other providers do it every other week. Some providers do it monthly. Clients sometimes come in and say to a provider, I have taken the PHQ-9 test online and I got a 12. What should I do? That is where your understanding of the PHQ-9 scores interpretation really matters. Now, one powerful use of the PHQ-9 screening tool is showing progress. For instance, a client's score might drop from 18 to 17 after several sessions. That's measurable improvement they can see. This kind of data can also support care planning, funding, and even insurance documentation. Let us go on to the next slide, where we will be discussing the strengths and the limitations of the PHQ-9. First, the strengths. It is quick, it is reliable, it is free, and it is easy to score. You don't need special equipment or software, just a PHQ form or a PDF. It's great for screening, tracking changes, and guiding referrers. But it is not a standalone diagnosis tool. The PHQ-9 screener doesn't account for trauma, cultural background, or co-occurring conditions like anxiety or substance abuse. Also, low scores does not mean someone isn't struggling. Remember what I said earlier when I was referencing the 0 to 4? And I said, even when someone, you score a patient with a low score, that does not really mean that everything is good to go. Low scores do not mean someone is not struggling. That is why you should always combine the PHQ-9 assessment with your clinical judgment, as well as active listening and follow-up questions. It's a fantastic screening tool, but it works best as part of a big conversation. All right, so let us recap what we've covered so far. By now, you now know how to use the PHQ-9 questionnaire, as well as how to interpret the PHQ-9 score and how the PHQ-9 scale scoring system really helps guide treatment decisions. You've also seen how the PHQ-9 questions map to real life symptoms and how scoring them helps flag depression from mild to severe. Whether you are using a printed PHQ-9 form or an online version, or even a PHQ-9 calculator, this screener is one of the most practical and helpful tools out there for assessing depression quickly and effectively. And remember, the PHQ-9 scores are just one piece of the puzzle. Use them to guide care, start conversations, and most importantly, support your clients. So I know that today's video went over the PHQ at a high level, and I recommend that you click on the link below so you can do a more deeper dive into reviewing the complete guide. That guide covers everything that we've talked about today and more, including listing out in detail the respective PHQ-9 questions, as well as the advanced PHQ-9 scoring interpretation. It also includes downloadable PHQ-9 forms, examples for you to use and implement, as well as printable PHQ-9 assessment PDF, which is great for sessions, training, and also client handouts. But don't stop there. Click on the next video to keep learning. We have a broad range of tutorials to help increase your success.